We are witnessing an unprecedented healthcare crisis in Alberta and Saskatchewan, end quote. Quote, patients and health workers are experiencing unfathomable choices and consequences. Early relaxation of public health measures has left two crumbling healthcare systems in their wake, and the dire realities are now in full view. Quote, what is happening is as heartbreaking as it was preventable. We are now in a situation where it's all hands on deck to address the state of crisis. All those lines, every one of them, come from the Canadian Medical Association's open letter today calling for a lockdown, a circuit breaker, a fire breaker in both Alberta and Saskatchewan, where the medical systems are being overrun. But the Premier of Alberta and the Premier of Saskatchewan are not doing circuit breakers right now. Why? Are they too much of a political landmine? What's the cost of ignoring the call? We're going to bring in the press gallery to talk about that. Tonda McCharles is a senior reporter with the Toronto Star's Ottawa Bureau. Carl Dockstader is the co-host of One Dish, One Mic, the executive director of the Niagara Regional Native Centre. And our special guest on this round is Dr. Alika LaFonataine, president-elect of the Canadian Medical Association. Good to have you all here. And I know Carl and Tonda, we're going to talk about the child welfare decision in a minute. We just had Mark Miller on. But since we've got Dr. LaFonataine on, you're in Alberta. Why the need to write the open letter? How dire is the situation?
So I'm an anesthesiologist by training. I trained in Saskatchewan, actually, born and raised in Regina, and then moved to Alberta over the last 10 years where I worked in northern Alberta. I can say without reservation that the situation in the health system today is worse than anything anyone could have anticipated. And a big problem with people understanding that is that unless you're in hospital receiving care, or unless you're a healthcare worker or close to a healthcare worker who's sharing what's happening day to day, you tend not to know what's happening in the healthcare system. But it is quite dire.
Just quickly, Doctor, what do you make of the fact that the governments of both provinces are not taking the advice of the CMA?
So I think that there's been a shift in tone related to the pandemic. I understand that after subsequent waves, we all wanted to walk past this over the summer and never turn back. The reality is that because of decisions we've made, we now have to do things that we don't want. And as part of that, the Canadian Medical Association is calling for, circuit breakers, fire breakers. Lockdowns are just one part of that. But we need decisive political leadership if we're going to move out of this wave. We won't move out of it otherwise.
I mean, are things going to get, let's just focus on Alberta for a minute. Are things getting worse, better? How dire could this get?
I think that there's a sense ideologically that if we just let this pandemic run rampant, that eventually everyone will get infected and we can just walk past this. The reality is that there's not really been a jurisdiction in the world that successfully achieved moving past COVID by just letting everyone get infected. In fact, we've seen health systems get overwhelmed by jurisdictions that have attempted this to different degrees. We're in a crisis situation right now where we can't even guarantee care for individuals who come to us for care. I have talked to my own children. I've talked to my brothers and my sister about their own children, making sure that we stay away from dangerous activities, because if we get hurt, there is the real question of whether or not we can get care. And we'll move heaven and earth as healthcare providers to ensure that you get care, and we'll use every last option. But our options are quickly being absorbed by persons demanding care in this pandemic.